Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Treatment of multiple sclerosis. So in the treatment of multiple sclerosis can have an acute attack, or there can be a prophylaxis. So treatment for each of them will vary. First, in an acute attack of multiple sclerosis, if the patient has an acute attack of multiple sclerosis, in acute attack, the patient can be given glucocorticoid treatment can be given. Especially, this glucocorticoid treatment is given for this glucocorticoid treatment will shorten the duration of exacerbation. Then we can also give what is the glucocorticoid which is given for multiple sclerosis. It is methylprednisolone is given in the pulse manner. Okay, this methylprednisolone is actually the best initial treatment of multiple sclerosis. Then we can also give plasma exchange can also be given in the patient. So this is for um, acute treatment of multiple sclerosis.
thank you and thank you for watching.